Hi guys! Welcome to my channel, and today we are going to make another video. And what makes this vlog a little more special to my heart, it's because I have invited some pharmacist friends who are also very much willing to share the information that they know to the viewers. Okay, so just a disclaimer guys, this is not a medical advice, and if you are seeking for a medical advice, please consult your doctor. Alright, so yeah, today our topic would be all about OTC meds. So ano nga ba ang mga over-the-counter medicines natin? Over-the-counter medicines, these are the types of drugs that we can purchase at any existing drugstores or pharmacies even without the cost of seeking for a doctor. Now, but although they are known as OTC, hindi naman porket OTC sila, ay bigay lang ng bigay ang mga pharmacies. So, may mga different reminders din tayo that we have to, to give to our patient para magkaroon pa rin ng tamang adherence or yung tamang paggamit ng mga gamot. Kasi kahit na over-the-counter meds sila, kailangan na babantayan din natin sila kung paano nila maayos na dapat na iniinom ang kanilang mga gamot. So today, I have given different topics to different pharmacists, and I hope that you guys will be very excited for this one, because you are going to see how important it is to always listen to your pharmacist's recommendations or even reminders if you are being prescribed for a certain drug. But today we are just going to circle our topic to over-the-counter medicine. So this will be the guide for our topic. What I'm about to tackle for today is a drug called acetaminophen, or also known as paracetamol. So, paracetamol belongs to the classification of drugs called antipyretic, fever reducer, analgesic, pain reliever. So, paracetamol is used for the symptomatic relief of mild to moderate pain, back pain, toothache, muscular or joint pain, even menstrual pain, and also fever, of course. Has a weak anti-inflammatory effect. When we say inflammatory is pamamaga. Minsan hindi na kinakaya ng paracetamol yung severe kind of pain like pamamaga. Ang ginagawa namin is ina-advise na lang namin yung patient to take NSAIDs drug instead. Non-steroidal anti-inflammatory drug like Ibuprofen. So, for the route of administration and kung paano siya i-take. So, start po tayo sa oral administration. Oral administration for 0 to 12 months is 10 mg per kilogram. So, depending on the weight of the child. So, for example, your child weighs around 7 kg. So, the dosage for your child is 0.7 ml 4 to 6 times daily. But, for 0 to 3 months po na patient, please consult your doctor po muna. For 1 to 5 years old naman, 2.5 ml to 5 ml 4 to 6 times daily. 250 mg siguro, 5 to 10 ml 4 to 6 times daily. We have oral tablets naman for teenagers, 325 mg. And for adults, 500 mg. 4 to 6 times daily rin po ito tinitik. And so we also have rectal route of administration, which is the suppository. 125 mg for 1 to 5 years old. 250 mg for 6 to 12 years old. Same lang din po siya sa mention ko sa oral syrup administration po. And lastly, we have intravenous or intramuscular route of administration. This kind of dosage form needs a prescription po. Hindi po siya OTC. And this needs for medical advice ng doctor. Special precautions po siya sa mga impaired liver or kidney. Yun po yung kailangan nating i-watch out sa pag-take po ng paracetamol. And lastly,
Please, wag nyo pong ipagsabay-sabay ang paracetamol sa, magsabi ako ng brand, okay? Bioflu, Biogesic, Decolgen, Nozep. Because they have the same pharmaceutical ingredient, which is paracetamol, and which can lead to paracetamol overdosing or poisoning. Ingat po tayo dyan. And lastly, for additional reminders lang po, antidote for paracetamol poisoning is NAC or N-acetylcysteine. And for the toxic metabolite of paracetamol is NAPQI or N-acetyl parabenzoquinone. So, sa mga nag-review dyan, take note, baka lumabas sa boards.
Hi guys! So, our next topic will be Ibuprofen. So, ano nga ba ang Ibuprofen? Ang Ibuprofen is a non-steroidal anti-inflammatory drug or mga gamot na nakaka-relieve ng pain and inflammation. So, Ibuprofen is a drug management to relieve pain and inflammation such as headache, toothache, and dysmenorrhea na nangyayari sa mga babae tuwing may period. So, aside from hyoscine, pwede ding mag-relieve ng pain ang Ibuprofen. So, ang Ibuprofen ay may dalawang dosage which is 200 mg and 400 mg. So, how to take Ibuprofen properly? So, best na uminom ng Ibuprofen kapag may laman ng tiyan or with meals. So, para maiwasan natin mangasim yung tiyan natin. Then, usually, 3 to 4 times a day tinitake ang Ibuprofen. So, reminders when taking Ibuprofen. Kapag wala na yung pain or inflammation, stop na. Kapag wala na siya, wala na din. So, reminders when taking Ibuprofen. So, do not combine Ibuprofen with other anti-inflammatory medicines. So, if you develop some abdominal pain or upset stomach or series of allergic reactions, consult your doctor agad. That's it for Ibuprofen. Hope you guys learned something.
For today's video, we will talk about antihistamines. So, ano nga ba antihistamines? It's also known as anti-allergies. There are different drugs under antihistamines, but we will focus on cetirizine. There are different generations of these antihistamines. So, the first generation, second generation, and the third generation. But we will focus on the pinaka-most common, which is cetirizine. Cetirizine, it is a second generation antihistamine. There are different dispensing considerations of cetirizine. Cetirizine, kailan nga ba siya madalas na nire-reseta? So, it provides a rapid relief of annoying symptoms of allergies like allergic rhinitis. What is allergic rhinitis? Pag sinabi nating allergic rhinitis, nakakita nyo doon sa word, di ba 2 words yung allergic sa rhinitis. Ibig sabihin ng rhinitis kasi. Kadalasan di ba makikita natin sa mga dulo ng mga word na gano'n na may TIS. Ibig sabihin nun, inflammation. So, rhinitis, it is the inflammation of the nose. Ibig sabihin naman ng allergic, it is caused by allergens, which can trigger our immune response. Okay, magsasite tayo ng example ng allergens. The pollens and the dust. So, kapag once na naka-inhale tayo ng alikabok or ng pollens, yung pollens kasi yun yung sa flowers, yung parang buwabuhangin dun. Okay, babahingin ka na. Tapos, mamaya-maya, makati na yung ilong mo, tapos sisipunin ka na. Kadalasan na-experience to sa mga nag-work sa construction kasi nga doon maalikabok. Tapos, yung mga lugar na kung saan polluted, like Manila, ganyan, mauusok. So, para maiwasan yung mga ganito, wear always mask. So, let's go back doon sa cetirizine. Most likely, since isa siyang second generation antihistamine, it is less sedating. Oo, less sedating siya. Kasi di ba karaniwan o kadalasan, iniisip ng iba kapag antihistamine o anti-allergies is nakakaantok. Pero hindi lahat kasi nga di ba may iba't iba tayong generations. So sa binanggit ko, pag sinabing less sedating, hindi siya masyado nakakaantok. Meron talagang hindi nakakaantok na antihistamine which is Loratadine. Pero magpo-focus tayo doon sa cetirizine. Pwedeng antokin yung patient natin na nagtitake ng cetirizine of about 10% probability. How to properly take cetirizine? So, although OTC medicine siya or nabibili siya without prescription sa butika, nakadepende pa rin sa timbang at edad nung pediatric patient kung gaanong ml yung ititake niya at yung dose niya. Dose range niya sa adult, Cetirizine is available as a tablet, 10 mg to 20 mg. So, usual frequency of taking this drug is 10 mg at bedtime or sa high doses naman, 20 mg at bedtime din. So, bakit at bedtime bago matulog? Kasi di ba nga less sedating siya. May possibility na antokin ka or may possibility na hindi din. Pero mas safe doon tayo sa before bedtime. Bibigay ako ng sarili kong experience. 4 months ago kasi I was diagnosed allergic rhinitis. Pero hindi Cetirizine yung reseta sa akin. So, it's Loratadine, the non-sedating antihistamine. Kasi kapag Cetirizine reseta sa akin, tapos nag-work ako, edi mamaya, antok-antok na ako, ganyan. So, dapat Loratadine i-take natin. So, atong Cetirizine, hindi rin siya pwedeng inumin or i-take kapag nag-work ka sa mga factories, pag nagda-drive ka, tapos pag piloto ka, iwasan mong uminom ng Cetirizine kasi it is less sedating nga. Reminders po, okay? Huwag po tayo mag-take ng Cetirizine kung tayo po ay magda-drive para po iwas aksidente. Sa mga machine operators po sa mga factories, iwasan din po natin ng uminom ng Cetirizine para iwas aksidente din. So, Loratadine is preferred po kung kayo ng allergies. Loratadine na lang po kasi siya ay isang non-sedating antihistamine. Cetirizine is also not recommended for pregnant women or breastfeeding mothers because Cetirizine is naipapas po siya sa breast milk excretion, so baka po madede po ng baby. In cases of allergies po sa breastfeeding mother and sa mga buntis po, consider the use of first generation's antihistamines first. That's all. Talking about Loratadine. Ang iba sa inyo alam na tong gamot na to, but we want to share our knowledge about some other over-the-counter drugs, kagaya nga itong Loratadine na to. So, what is Loratadine? Loratadine, it is used to relieve symptoms associated with allergic rhinitis such as sneezing, yung pagbahing, runny and itchy nose, and watery eyes, and also some other skin conditions kagaya ng pangangate and also skin rashes. At sometimes, minsan, binibigay din siya sa may mga eczema. So, what dosage available in the market or in the pharmacy? So, for adult dose, usually it is 10 mg per tablet. And the second is for pediatric dose, 5 mg per 5 ml syrup. So, next, how much and how often should you use this medicine? So, for adult dose, 10 mg per tablet once daily. And for 5 mg per 5 ml for more than 12 years old and above, 10 ml once daily. So, for 2 to 12 years old naman, over 30 kilograms, 10 ml once daily din. No? And lastly, for 2 to 12 years old, below 30 kilograms, 5 ml once daily, or as prescribed by the physician. So, sa food and drug interaction naman, you should tell your doctor about other medicines that you and your child is taking, especially mga ibang gamot, kagaya ng pang-ubo, mga pang-sipon, tsaka mga pang-allergy. Kailangan mo muna i-inform si doctor na umiinom ka ng ganitong klaseng gamot. So, maiwasan ang drug-to-drug interaction and drug-to-food interaction. But before taking with Loratadine, inform mo muna si doctor kung meron kang liver and kidney disease. So, baka magkaroon ng adjustment sa dose or baka you need a dosage adjustment or special monitoring during the treatment. I'll give some key facts about Loratadine. So, first, this medicine is usually given to pilots kasi nga it is a non-drowsy antihistamine, unlike other antihistamines and anti-allergy na nakakaantok. So, pwede siyang i-take in the morning or in the evening. So, pwede rin siya i-take with or without food. So, pwede mo siyang i-take kahit walang laman ng tiyan, kahit after kumain, pwede rin mo siyang i-take. Then, kapag nakalimutan mo din siyang i-take, it is not harmful naman. Basta pag natandaan mo na siyang, ay, nakalimutan kong uminom. So, inom ka na kaagad. So, according to MIMS 2016, Loratadine is under category B, so which means it is safe to pregnant women. I hope you enjoyed it at nakatulong ito sa ating mga patients and other pharmacy students. Because as a pharmacist, our job is all about helping patients and the public assessing their conditions and making decisions about which medicine they should take, and we also promote the safe use of medications and improve clinical natures.
Hi guys, may topic for today is regarding Loperamide. So, ano nga ba ang Loperamide? Ang Loperamide ay isang OTC anti-diarrheal agent used for the treatment of diarrhea. So, ano ang ginagawa ng Loperamide pag nag-take tayo? So, it slows down the movement or the motility of GIT or yung stomach natin. And it decreases also the frequency of bowel movement, thus it makes the stool less watery. So, Loperamide is administered via oral route or via mouth, and the initial dose is 4 mg or equivalent to 2 capsules agad-agad, and followed by another 1 capsule pag nagbawas and another 1 capsule pag nagbawas ulit. Take note that the maximum dose of this drug is not more than 8 mg or 4 capsules in a day. So, it is best or prescribed, best advised then na i-take ito in an empty stomach or 30 minutes before breakfast or 1 hour to 2 hours after meal. So, take note that it has also side effects pag na-overdose tayo. Tolerable naman siya or nare-reverse, but if the symptoms worsen, we should consult our physician or doctor. And another information or important advice kapag nagda-diarrhea tayo, we should also take electrolyte replenishers like ORS, Gatorade, Viva-Lite, and Pedialyte. So, it help us to supplement yung mga minerals na nawawala sa atin and to prevent dehydration. Take note, ORS or mga electrolyte replenishers ay hindi siya treatment. Thus, it is only a supplement. So, that's it. If you have concerns and other queries regarding water medication, just ask your pharmacist. And
Ayan, so ang topic naman na binigay sa akin or napunta sa akin guys is yung Ambroxol. Ano nga ba kasi ang gamit ng Ambroxol? So first, what is the therapeutic category of an Ambroxol? So Ambroxol is a mucoregulator. Now, what does a mucoregulator do? Anong ginagawa ng isang mucoregulator? So, it is responsible for increasing the water portions of the mucus in order to allow an easier expectoration. So, sa madaling salita, ang isang Ambroxol daw ay isang gamot na mas pinapadali niya ang paglabas ng plema, lalo na sa mga pasyente natin na merong ubo na merong plema. Okay, so yun nga, indicated siya for cases or diseases that are associated with productive cough. So pag sinabi nating productive cough, ito yung mga uri ng ubo na merong plema. Okay? 'Di ba dalawa yung klase ng ubo? Meron yung ubo na makatilang, meron naman yung ubo na pag umubo ka, merong kasamang plema. Or meron din naman yung klase na ubo na kapag umubo ka, ang alam mong may plema pero mahirap mo siyang ilabas. Okay, so indicated ang ating Ambroxol for cases or diseases na associated sa productive cough or yung mga ubo na merong plema or nahihirapan kang ilabas. Okay? So, kaya napaka-importante guys na kapag bibili tayo sa mga butika natin, ang number one concern natin para sa ubo is, or ang number one question sa atin ng ating pharmacist is, ma'am or sir, meron po ba kayong plema or wala? Okay? It is very important to, answer your pharmacist kung meron kayong plema or wala para ma-assess natin ng maayos kung ano yung best over-the-counter medicine na pwede naming mai-recommend po sa inyo. So, yun nga, what are the usual dosage strength of our Ambroxol? So, kadalasan nagre-range siya from 30 mg to 120 mg. Pero, ang kadalasan na nakareseta lang is 30 mg or 75 mg. Now, how are we going to properly take our Ambroxol? So, the focus lang natin ngayon is yung adult dose lang, guys. Kasi medyo dapat talagang sa pediatric dose, may mga computations pa yon. Kadalasan vinavary natin siya kung ilang taon na siya or kung ilang kilograms. But for those cases, ililive natin yon sa mga doktor natin. Kasi syempre sila lang yung makakapag-evaluate dun sa pasyente. Ang focus natin, guys, is yung adult dose. So, kadalasan, 30 milligrams for 3 times a day is a good frequency kung paano mo siya iti-take. And also, kapag 75 milligrams naman, once a day lang. Alright, so just to take note, guys, ang Ambroxol po, it is best taken with meals. Bakit? Bakit kaya with meals ang dapat na pag-take natin sa Ambroxol? Kasi mas bumibilis or mas maganda ang absorption ng Ambroxol kapag tayo ay may laman yung tiyan natin. Okay? And some additional reminders, guys. So, kung paano nyo nabili yung inyong Ambroxol, do not open or do not chew it. So, kung paano nyo siya nabili, ganun mo rin siya na buo na iinumin. Pero, syempre, alisin mo siya sa lalagyan. Alright? So, precautionized din siya, guys, for pregnant patients, especially who are in their first trimesters or also second and third trimesters. So, yeah, for those cases, kapag ikaw ay buntis, tas meron kang productive cough, siguro mas best na lang na tanungin na lang yung doktor natin. Okay? And if you experience hypersensitivity reactions like bulging or yung pagtaba ng labi mo, di ba, yung medyo tumaba siya or nangangati ang tongues mo, you have to report those cases to the pharmacist kung saan mo siya binili. Or for worst cases or severe cases, you have to consult your doctor. Alright?
Hello everyone! Today I would be sharing to you information regarding the drug Bisacodyl. So Bisacodyl is a type of, or it is a laxative. You know, there are different types of laxative actually. Meron tayong tinatawag na bulk-forming laxatives, may osmotic laxatives, meron ding stool softeners, meron ding stimulant laxatives. So, Bisacodyl belongs to the class stimulant laxatives. So, how does Bisacodyl works? Actually, when you take Bisacodyl, the effect would be, it would irritate the smooth muscle of your large intestine, thereby promoting peristalsis. When you say peristalsis, it's like the wave-like movement of the muscles. So, if increased ang movement ng muscles, mapopromote yung, evacuation of the stool from your body. So, that's basically how it works. So, merong iba't ibang dosage forms na available for Bisacodyl. Merong tablet, merong suppository, meron ding enema. Pero usually, ang ginagamit din, is tablet. So, for tablet, merong 5 milligrams. Usually, 5 milligrams din yung Pero meron din ako nakita na 10 milligrams. So, for adult, usually binibigay, for tablet is 5 to 15 milligrams at bedtime. Why at bedtime? Kasi kapag tablets, ang effect niya would be observed after 6 to 12 hours. So, you take it before you sleep and then in the morning, dun yung effect niya. Additional information din, kapag suppository, usually mas mabilis yung effect niya. 15 to 1 hour, meron na yung effect, mas mabilis. Pag enema din, parang 5 to 20 minutes lang meron ng effect. What should you consider when taking Bisacodyl? One thing is, you should not take it within 1 hour with milk preparations or milk products, and also antacids. It's a no-no when you're taking Bisacodyl. Another thing is, do not take it consecutively for more than 10 days or for more than 1 week. Why? Because of course, it would promote laxative dependence na tinatawag natin, wherein kapag lagi mo siyang tinitake, at some point, hindi na siya e-epekto sa'yo. So, ang tendency, you would have to increase the dosage, which is not good actually. That's basically it. Thank you so much for watching, and always stay safe
and consult your pharmacist regarding your drugs. Stay healthy!
Hi everyone! So for this video, I'm going to talk about HNBB or the hyoscine and butylbromide. So the most common brand for this generic name here in the Philippine market is we have the Buscopan. So alam naman po natin kung ano po yung gamit ng ating Buscopan. We usually purchase this medication in the community pharmacy if we have dysmenorrhea, abdominal pain, or abdominal cramps, or yung pananakit po ng ating puson. So, aside from that, the HNBB or Buscopan it belongs in the category of anticholinergic or the antispasmodic drugs. So, ano po ba yung ibig sabihin ng ating anticholinergic drugs? Ito po yung mga drugs na blina-block yung action po ng ating muscarinic acetylcholine receptors. So, ano po ba yung mga actions ng ating muscarinic acetylcholine receptors? We have diarrhea, urination, meiosis, bradycardia, bronchoconstriction, emesis, lacrimation, and sweating. So, if we are going to take Buscopan o yung HNBB po natin, kabaliktaran po nun yung action na mararanasan po natin. So, in the market, we have tablet, IV, and rectal available for sa ating HNBB. Sa tablet, we have 10 milligrams. It is taken 2 to 3 times a day, maximum of 6 milligrams per day. So, sa IV naman po, we have 10 milligrams and 20 milligrams, maximum of 100 milligrams daily. So, as a reminder po, when we are taking HNBB, side effects po ng ating HNBB, we have constipation, yung mahirap po na pagtae or pagpoops. Another is yung pamamaga po ng ating lalamunan. So, I advise you po na we should drink plenty of water to lubricate po yung ating lalamunan. Number 3, hindi po advisable yung ating Buscopan or HNBB sa mga patients na merong heart problem or hypertension. Kasi yung Buscopan po natin, it will increase our blood pressure. Kaya, it is not advisable po sa ating mga hypertensive patients. Another, it is not also advisable to patients na merong eye problem. Specifically po is glaucoma. Kasi it will increase the chance na mabubulag po tayo if you are going to take Buscopan or HNBB along with this condition. Another, when taking HNBB or Buscopan, we will experience dizziness, sedation, or sleepiness. Kaya it is not advisable po na to take Buscopan if we are operating machines or going to have a long drive during the day or at night if we are going to take this drug. So, another thing is we should always consult our pharmacist or our doctor if we are taking antidepressants along with Buscopan. Kasi po, bababa yung effect po ng ating antidepressants if we are going to take this together with our Buscopan. Another is antihistamines like Cetirizine. Pag pinagsabay po natin ang Cetirizine or Buscopan, it will increase yung sedation effect po ng ating Buscopan. Another is yung antacids or antidiarrheal drugs. If we're going to take Buscopan, we should take this 1 hour before antacids kasi pag pinagsabay po natin yung yung ating Buscopan at saka yung ating antacids, bababa po yung effect or mawawala po yung effect ng ating Buscopan. So, ayun guys, I hope meron kayong natutunan about HNBB or hyoscine and butylbromide. Now that ends our topic for this video guys, and I hope na marami tayo ulit natutunan sa mga topic na pinag-usapan natin ngayon, and I personally would like to say thank you for my colleagues and sa mga friends natin na pharmacists na sinamahan tayo sa ating vlog for today. And I really appreciate it. You have given me so much time, no, para mag-record kayo ng mga video na po pwede nating i-insert sa ating vlog natin for today. Thank you so much, guys. I salute you. And to all the working pharmacists who are all around the globe, I would like to give a salute to all of you. And this video is also made to raise awareness that we are not just licensed to be a tindero or tindera, just like how some of the Filipino people see us. No, we are licensed to help you guys on how to properly take your medicines. And thank you so much for watching this video. That ends our video. I am Elena Costales.
I am Denise Barbado Salvador.
I am Kimberly Joy Babag.
I'm Darnie A. Celestino.
I'm Diane A. Celestino.
I am Kate Angel Dio.
I am Joshimi Agpawa.
And I'm Jobin Chilosaro,
Your pharmacist.
Your pharmacist.
your pharmacist.
Your pharmacist.
Your pharmacy.